Thanks for watching. Today I'm seeing a patient back, RW, who has had a Vertiflex Superion interspinous spacer, which, if you look at some of our other videos, is a spacer designed to hold open the spine so that the nerves can breathe that had previously been impacted or pinched from spinal stenosis. So how long ago did we put in the spacer?
8 days ago.
8 days ago. So here you are sitting, and so I like people to keep in mind what the competitive alternative is, which is a laminectomy. And for most people, that's about a 3.4 day stay in the hospital, and then a many week to many month recovery. So our W, who's sitting next to me, walked in on your own power, and he's recovered now 8 days since the implant of the spacer. So what was life like prior to the spacer being implanted?
Well, the spinal stenosis had progressed to the point that it was more or less constant pain that wasn't responding to other treatments like epidural injections.
Okay. And how long could you walk?
Without pain?
Yeah.
Sometimes 100 feet, sometimes 400 feet.
And what would you feel when you walked?
Usually my leg would be really painful, and my buttock. It was mainly leg and buttock pain when I walk. Sometimes lower back pain when I walk.
And then you'd have to sit down in order to get relief?
That or bend over and stretch. Okay. Having a stand-up job, I don't get to sit down a lot, but if I bent over and for about 20 seconds, that helped a bit relieve the pain for a while.
Very good. And so now what are your symptoms?
Don't have any spinal stenosis symptoms, no sciatica.
That's fantastic, especially because you get to avoid the long stay in the hospital and the surgical risk. So what was the procedure like for you? What did it feel like?
I didn't feel anything. I went to sleep and I woke up. That was it. I did have a dry throat, I guess, because the tube went down there, and I took some Cepacol, and that took care of that.
Good.
I didn't have to take any of the codeine.
Okay.
The next day, first day after surgery, that's when I had the most pain, but I was able to tolerate it without taking the codeine. I didn't want to take that.
Yes. Okay.
And that was on a Monday when I had the surgery, and Friday I went back to work.
Wow.
Yes.
That's pretty fantastic. So I'm videoing you because you had a great response. Now, on average, we've had about 80–90% success of relief of stenosis symptoms with this procedure, which is pretty amazing. We've done quite a few now. That said, is there anything, any concern or any advice you would want to give someone who's thinking about this procedure?
It's worked well for me. I haven't experienced any downside yet. I still have that weakness that you explained, and the achiness in my lower back because of the atrophied muscles and nerves, but that's getting better. So right now everything seems like it's going the way it should be.
Perfect. Well, listen, I appreciate it very much. Okay to put this on our YouTube channel?
Sure.
Terrific. All right, well, thanks so much for watching.
Thank you.